He came with a simple complaint for him, which was very, very concerning and producing reasonable amount of anxiety within him. He had these kinds of white patches on the tip of his penis. This case, when it came to our OPD, this man appeared to be reasonably anxious. He had a complaint of these white spots on the tip of his penis. He had an intense desire to itch that region till it bled. Now, these complaints have been experienced by him since 1.5 months and have increased gradually. The tiny spot, white spot that you see, that's where the whole problem began to the largest plot, white patch that we are seeing. When we further investigated him, it turned out to be a case of candidial infection. And having understood these basic issues, the homeopath explores further and beyond. We went on to take his other details. Very interestingly, one finds a lean, thin fellow, looks older than his age. He has multiple warts on face and neck. They are all painless. There is perspiration which is offensive. There's a desire for eating chicken, pungents, and sweets. There's a sense of burning while passing motions if he has consumed chili items. And the burning continues through the next day as well. There has been a sexual history which was explored, and there is a slight glimpse of this man having experienced premarital sex as well. Has dreams, and then there is a history of a cerebrovascular accident which affected his right side, and it took 10 months for a complete recovery for him. When the exploration began, and knowing the location of the complaint, the physician student who was asked to go and take this case was instructed to check by the supervisor whether there is any history of exposure. Now, when this question was asked, this person very vociferously shared, I don't do such dirty things. My uncle died of HIV. I am scared of it, and hence I don't do such things. I have children whose care I am supposed to take. I want to educate them. Who will look after them if something happens to me? Therefore, he was trying to indicate to us that he has not gone into the area of outside exposures. When we were inquiring about his job, we realized that he basically works as a security guard in one of the housing societies. And he was known to be very social and friendly with most of the society members. He ran a number of errands for them, for various people. So it was not abnormal for someone to ask something to be done and this gentleman obliging them to help them. But in one such instance, a lady requested him to come and clean his toilet of her house. This disturbed him to no extent. He felt very angry, and he says, I do all sorts of works because I help them, but I am not a man who is going to wash their toilets. By his standards, I am a security guard and I will not do low grade work. And he fought with the lady. He fought with the lady, argued with her, saying ki how dare she ask him to do such menial works. And in the state of anger, he left his job. It was an intense sense of humiliation he was sharing with us that he experienced. He felt that he should go and commit suicide. He also wanted to go and slap her. When the society members realized that this gentleman, under this incident that has occurred, has decided to leave the job, they started pursuing him not to leave. They actually went to that lady as well and requested her to go and apologize to that person. And the lady did. The lady did go to this man and she requested him to reconsider his decision and kind of apologized for what had possibly hurt him when she asked him to do a certain task. What happened then? She, in fact, went and apologized. But this man was in no mood to reconsider. He told them that he cannot work there now. He simply cannot forget what has happened. So it is best he leave the place. And he did leave the place. He shared another incident of his life. It's an old incident around 10 or 12 years back. The patient's wife had gone to her mother's house and he was, as the custom prevails in his community, the husband of the lady has to come to her house, her father's mother's house, and collect the lady and take her back to their house. This is a process, ritual, you can say social norm that exists in that community. And as every parent desires that their daughter should stay for some more time, his parents-in-law also requested him, okay, why don't he permit her to stay for a few more days?